Aid agencies have sounded the alarm as a cholera epidemic spreads across the Democratic Republic of Congo, where hundreds of people have died. Health officials have recorded tens of thousands of suspected cases of the disease this year in the Central African nation. The World Health Organization says more than 500 people in the Democratic Republic of Congo have died in a cholera epidemic that is sweeping the country. This year's epidemic, which has already hit at least 10 urban areas, including the capital Kinshasa, is particularly worrying as it comes at a time when about 1.4 million people have also been displaced by violence in the central Kasai region. Dr. Emmanuel Lampert is the chief of mission for Doctors Without Borders for Belgium and DRC. In Kimpese, central Congo, medical teams from the International Humanitarian Organization have set up a makeshift clinic to treat some of the region's worst cases of cholera.
Since the beginning of the year, there has been more than 24,000 cases of cholera, and half of those cases were treated by the MSF team on the ground. Unfortunately, there has been some deaths, and that is why it is important to once again raise the alarm on the epidemic, which has spread throughout the country, and to call on all stakeholders to get involved.
The WHO says at least 528 people died last week, and the epidemic has now spread to 20 of Congo's 26 provinces. Andre Zakatango is the head of a government-run cholera treatment center.
There's a huge lack of sanitation. It's really dirty. As you can see from the population and the surroundings, they have no toilets. There's a lack of access to clean water. All those factors contributing to the spread of this infectious disease.
Pakajuma, an illegal settlement that extends along the railway line to a natural basin into which waste from the city's septic tanks are dumped, is one of the worst hit areas in the city.
We always see children falling sick and their parents don't understand the symptoms of cholera. But when the child is taken to the hospital, doctors tell you that the child is suffering from diarrhea and is then taken to a cholera treatment center, but it's often too late and the child dies after that. So the government needs to sanitize the residents of Pakajuma so that they can understand how cholera is transmitted.
Aline Ekofo, another resident of Pakajuma, agrees with her neighbor.
Here in Pakajuma, we're constantly exposed to all sorts of epidemics. We breathe in polluted air. The children are exposed to all sorts of infectious diseases such as malaria, germs, cholera, typhoid. So it's not good.
Outbreaks of waterborne disease occur regularly in Congo, mainly due to poor sanitation and lack of access to clean drinking water. The World Health Organization has dispatched a team of experts, including epidemiologists and public health specialists, to Congo in an effort to help contain the disease.